for a few months, I've been posting on Facebook every day this chart of the 7-day average of new cases for Harrisonburg going back to April. It includes the number of new cases for the day, the date, the total number of cases so far, and the average. I also include this information for Rockingham County. I also include the 7-day average of positive tests for the district, the Central Shenandoah Health District, and for the state as a whole. I also include each day the 2-week total for city and county and the numbers that would make us a hotspot for that 2-week period. These numbers are relatively easy to put together with some qualification. If you are a numbers nerd, I am one. If you have some Excel skills, I have some. And if you just plain enjoy numbers and want to try and add something factual, something objective that you can see, touch, and feel in a year that has been extremely uncertain in so many ways. The information begins here at the Virginia Department of Health coronavirus site, which is obviously vdh.virginia.gov/coronavirus. A couple of places worth going from there. First is the data download page, and from there the main database, the main data set, the main spreadsheet is here at the top. Clicking on it will take you to another page, another page, another page. It will take you to another page, this one, that you can click on export CSV, comma separated values for Excel, and then save and open that particular spreadsheet. I'll be coming back to that at some point, but I simply wanted to point out that that's how you get to the data. I said that rather quickly, but this is a video. You can replay it. The daily dashboard is where most of the information is that I'm using daily and that people might be interested in following on a daily basis. Before going there, I should point out the Virginia's key COVID-19 measures. If you go here and begin clicking through some of this information, you will find a great deal of your questions about COVID and the numbers have already been answered. This might also be a good time to point out that if you don't enjoy numbers, if you're not good with numbers, not everyone is. I can't sing or dance myself, so I know that some people are not good at some things. You probably know somebody who is. And most people who enjoy that kind of thing would enjoy working with these numbers if they know where they are. The data download, again, is the main point. It has a spreadsheet of number of cases, number of hospitalizations, and number of deaths for every locality in Virginia from the beginning of the pandemic in March. Now going over to the daily dashboard and then going down to this stream of tabs, this is again the three main things: the total cases, the total hospitalizations, and the total deaths. From this point, you can, of course, click on any of the individual localities and get both the total numbers and the numbers per 100,000 of population. The demographics are broken down by health district. For instance, here we can see that let's pick one. Virginia as a whole, 19,896 out of about 102,000, or around right around 19% of the cases are in the 20 to 29 age group. Picking just a couple of the Central Shenandoah Health District, we look at that same number and it's 562 out of 28, or about 24% of the cases in the Central Shenandoah Health District are in that age group. Interestingly, if we go down to Virginia Beach, almost a quarter of theirs are in that age group. So that's not as interesting a number as I thought it would be. Let's go back up to the top of this. The locality tab takes you to the daily case count, hospitalization count, and death count for each of the localities in the state of Virginia. Harrisonburg, for instance, today, August 12th, 1,083 cases, 81 hospitalized, 31 deaths. Once you've clicked on Harrisonburg and it's highlighted, if you go to the bottom, it gives you the cumulative number of cases and the cases on any given day. Harrisonburg does have a steep rise in the early days and then a gradual flattening of our local curve as the virus begins to get under control in Harrisonburg beginning sometime in late May, early June. Rockingham County, a much steeper, but still not precipitous, a steady increase in the number of cases. This is the one where I really wanted to go down to Virginia Beach, and this is what Virginia Beach has looked like since the beginning of phase 3 around July 1st. 1,300 around the beginning of July, 11:45, and somewhere between 4 and 5, about 4.5 times as many cases now. That's the very steep increase for Virginia Beach. And again, you can click at any of these. City of Franklin, for instance, this has quite a climb, but a low number of cases, 200 for the locality. Back to the top, the Harrisonburg and Rockingham numbers from here will become relevant again in just a few minutes in this particular video. The outbreaks I've not found particularly helpful, but then I haven't gone into them in depth. We do know that most of Harrisonburg's cases came from outbreaks at apparently at local nursing homes and poultry facilities. And once those areas got things pretty much under control, that's when our curve started to flatten. As I mentioned, the testing numbers here, 7.3% positive cases over the state of Virginia for the last 7 days. This was as high as 20% at one point. Obviously, this is a function not just of percentage positive, but also how many actual tests are conducted, how many tests are available. This number for the Central Shenandoah Health District peaked during the outbreaks in April and has been lower than the state of Virginia for most of the last 3 months. Going back to the locality figure, I keep a spreadsheet that begins with the COVID-19 public use data set. This is a copy of it that I've saved and used the cases with average charts. And this is the one from, this is not the one from today, my apologies. I'm going to click over that as well. And we're going to go back and download this from scratch before I lose my audience. So going back to the data download and to the, there's data download and COVID-19 public use data set, which will begin downloading sometime this afternoon. I'm not doing anything else. Export it to comma separated values for Excel, and then open it up, I hope. Okay, if you don't know how to download an Excel file from that location, you're probably completely lost anyway, but let's go over here, tell it to open this, ignore this gibberish, click on next. They're comma separated values, so tell it to separate by comma, oddly enough, and then next and finish will open it up. At this point you can sort by the FIPS code. FIPS stands for Federal Information something something. The spreadsheet comes in sorted by date, going back to St. Patrick's Day. And then by sorting by the FIPS code, it will wind up being separated by whatever your locality is. It's a good idea to go through it first and figure out the FIPS code for your locality so that you can search more easily. Harrisonburg is 51660. And you can, at this point, define and separate out your own locality for any figuring that you might want to do later on with those. I took this number and put it into this master spreadsheet that I use. Each day, I go to the bottom of the spreadsheet. I go to the daily dashboard at vdh.virginia.gov/coronavirus. I go to the localities tab and add in the number from Harrisonburg and from Rockingham County. Today 1083 for Harrisonburg, 957 for Rockingham County. Putting in the 1083 for Harrisonburg and then copying down these two columns and then filling in the date, it basically takes 1083, separates or subtracts yesterday's 1082, and then gets an average of the last 7 days over here. So from that we get that there was one new case for Harrisonburg today, that the 7-day average of new cases is 2.0, and the total number of cases is 1083 at this date. Charting in Excel is relatively simple if you've done it before, or if you happen to like working with spreadsheets. Basically go to the internet and type in something like create Excel chart. It'll give you an idea of how to do this. Each day I have to go in, select data, and change these numbers to indicate that I've added another bar to the spreadsheet showing what today's numbers are. I also keep these for Rockingham County numbers, but haven't updated that one for a while. Reiterating, all of this comes from Excel and from the Virginia Department of Health website, which includes demographics, locality, outbreaks, testing, and a host of other information. You probably know somebody somewhere who enjoys working with this kind of stuff and who will go in and put together charts and stuff for you if you've got some interest or some curiosity. Do try to keep in mind that I, for instance, am an amateur. I'm not an epidemiologist. I'm merely reporting a daily statistic. A couple of the others that I sometimes compute are how many days it takes for another 100 cases to break out in Harrisonburg or Rockingham, or how many days it takes for another 10,000 statewide. Those are on my Facebook site if anybody wants to take a look at them. But do keep in mind that the deeper you get into these, the more detail, the more granularity to the data, the more you might be creating numbers that you don't fully understand. Keep that in mind with anybody that you might ask to help you out with this as well. These numbers are here. There's a lot of information. There's a lot of stuff you can do with it. On the one hand, as I pointed out, keep in mind that you may wind up putting numbers together that go beyond what your knowledge is, and you may wind up telling yourself or others things that aren't quite accurate. Be careful about what data you're selecting and what you're doing with it. On the other hand, these numbers are updated every day. There's a lot of information here, and they do add some level of certainty to what has been a very uncertain year. They do add something real to something that we can't see or touch or feel. This video will be going on my Facebook page. You can message me from there if you want more information about it. I'll do what I can to help. As I said, I update this daily. It's something that I do because I enjoy it, and it's something I'd be happy to help anyone else with.